That sounds good.
Good evening, everyone. My name is Jewel Jones. We're at the Human Services Committee. It's February 9th, 2026. It is 6:30 p.m. Welcome, everyone. Okay, there are some ground rules, everyone. No one may speak until granted the floor. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand and wait to be recognized. To raise your hand through Zoom, click the participant's icon and you will find the raise hand function there. Members should not engage in a back and forth discussion. The chair will recognize the next person to speak. Please keep your questions and comments brief and on topic to the discussion. Members of the public, if you have a question or comment about the subjects on the agenda, please raise your hand and wait to be recognized. All right, so I'm going to call the meeting to order, and we're going to have roll call.
Leslie Colon,
Present.
Otter Garizi, present. Chancellor Gregg,
Present.
Jill Jones,
Here.
Jennifer Meyer,
Present.
Tanya Phelps, absent. Valerie Ponte,
Present, trying to fix my camera again.
Janelle Shatija. Did I pronounce your name as Janelle or Janelle?
Janelle.
Janelle. Okay, I got it. And Robin is absent.
Yes.
You have a quorum.
All right, thank you. So let's, everybody's had a copy of the agenda. There's adoption of the agenda. Any comments?
Yeah, can we add to the agenda a moment of silence for the people the 18 people who passed away due to the frozen temperatures, especially?
Okay, yes, we can do that. That doesn't require anything. All right, any opposition to adopting the agenda? Seeing none, the agenda is adopted with that addition from Chancellor. Approval of committee minutes. We all have a copy of the minutes. Any questions, concerns about the minutes? Additions, comments? Hearing none. So that was the committee minutes of the January 12th, 2026 committee meeting minutes. That has been approved. I'm going to go through all the agenda items right now before I move on. So there are announcements, informational updates. We have New York City Department of Health and Mental Hygiene, East Harlem COAT Emergency Management, Center for Comprehensive Health Practice, Housing Works Connect program, followed by presentations and discussions. There will be an informal informational presentation about the available psychiatric services at the Hope Center and the new July 2026 OMH Mount Sinai Research in Public Psychiatry. And that's a Crystal, I don't know how to pronounce your last name, sorry, Adhemer from Mount Sinai, among others presenting. We'll have old business, new business, roll call, and then there will be an adjournment. That is the agenda for tonight. All right, so just go back to the minutes, so just make sure they were adopted. Was there any opposition to adopting the minutes? Hearing none, the minutes are adopted from the January 12th, 2026 committee meeting. Announcements. Anyone have announcements? Chancellor, did you want the moment of silence? When did you want the moment of silence to take place?
Yeah, we can do it now.
All right, so did you want to leave that?
Everyone, will please just have a 30-second moment of silence for the at least 18 people who passed away due to the extreme cold temperatures that happened from January 23rd to February 8th, where 3 people were found yesterday. Thank you all.
Thank you, Chancellor. All right, I do have announcements. One, I wanted to announce that I did attend the legislative town hall. I don't know if I announced that from before. I thought that went very well. That took place on January 16th. That was with the Harlem Services Consortium of East Harlem Community Health Committee, and New York State Senator Cordell Clare's office, and among other elected officials were also there. I was there on Zoom. I understand that they were standing room only. It was at the Hunter College School of Social Work, so that was very well attended. And I do plan on attending future events, such events. I also want to announce that there are 3 CABs, or 3 health and hospitals, that will be having their legislative breakfasts. Among them is Henry J. Carter. Their legislative breakfast will be taking place on February 20th at 9:30 at 1752 Park Avenue in the Renaissance Room. That's Henry J. Carter Legislative Breakfast, and you can RSVP by today, February 9th, and I will provide this. So I think it's important that folks go to these legislative breakfasts of the community advisory boards. That's Carter. Bellevue will be having their legislative breakfast on February 27th, another Friday. That is from 9 to 11 at Bellevue, 462 First Avenue at 27th Street in the Rose Room. There is an RSVP for that. Happy to provide that. Well, it's basically Community Advisory Board at nychhc.org. And Metropolitan's legislative breakfast will be taking place on March 5th, Thursday. Well, actually, and Leslie, if you want to talk more about that, feel free. She's on the CAB. So their breakfast will be taking place March 5th, Thursday, from 9 to 11 at Draper Hall, which is across the street from Metropolitan Hospital at 1918 First Avenue. Their theme is expanding healthcare services in 2026. They have an RSVP. We can provide that information to you, or you can just talk to Leslie. So those are, and I will typically discuss cabs, especially in Manhattan. So even south of us at Bellevue, but Henry J. Carter. I don't know. I don't have Harlem Hospital. If anyone knows when Harlem Hospital is having their community advisory board or their legislative breakfast, please let me know. But those are the ones I know about, and I have flyers, and I just post flyers. Any questions about the cabs and their legislative breakfasts? No? Okay. I do also want to announce, let's see, I received an email from the CUNY graduates at School of Public Health. They are having a panel on Tuesday, February 24th from 5:30 to 7:30 at the CUNY Grad School of Public Health and Health Policy. The name of this forum is called Public Health Under Pressure, Building a Path Forward. Again, February 24th, 5:30 at the CUNY School of Public Health and Health Policy, which is at 55 West 125th Street, 7th floor, room 708. If you any, again, that'll be posted somewhere. Let me see. Those are the main announcements I had. Any questions? All right. So informational updates. Do we have someone from the health department?
Only it's not on.
Oh, somebody say it again.
Only it's not on.
Okay, Pauline. So East Harlem COAD, Emergency Management.
Hi there, my name is Maya. I'm representing the East Harlem COAD. Thank you so much for having me. I'm very happy that we had our moment of silence. The main update I was gonna share has been around our amplification of the New York City Emergency Management warming centers and their efforts to get the word out. So this weekend, on Friday, we were a part of a push to get out the word. So I know I was on 2nd Avenue, posted in about 25 different businesses to let folks know about the warming centers locations, as well as what to do if you see someone outside, and calling 311. So I do hope that made an impact this weekend. We also wanted to share about our upcoming meeting, which is February 19th, and it'll be at the Health Action Center. So please, anyone's welcome to come. And the RSVP is to the East Harlem COAD email address, which is just eastharlemcoad at gmail.com. And I can put that in the chat as well. Otherwise, find us at the Health Action Center on February 19th at 4 p.m.
Great. Thank you very much. Any questions? Online, any questions? Can't see. Thank you very much. Good to see you. Do we have someone from the Center for Comprehensive Health Practice? By any chance? Hearing none, seeing none. Housing Works Connect program? No. Okay, who's left that wants to present or is providing informational updates? Anyone? All right. So, so just so you all know, I actually sent an email out to you all in terms of like the informational updates and so I said, in addition to what we have on paper, we should be hearing from all of our agencies as it relates to human services. So I have a number of entities listed there, and the hope is, and the expectation, frankly, is that we will be hearing from all of these entities during our committee meeting. So I put as an example, besides the regular ones, Department for the Aging, Human HRA, Department of Immigration Affairs, Department of Homeless Services, Department of Veterans Affairs. So we should be hearing from these folks. And in my email to you all, I indicated, if you don't know, there's something called a District Service Cabinet meeting when agency heads and representatives actually all meet, and this District Service Cabinet meeting, and our district manager attends that. And these we hear from all of the different like city agencies, FDNY, NYPD, DOH, and there's representatives there that discuss things. So we should have those people that attend those come to the committee at the committee level. That's the expectation. Any questions or concerns about that? Any comments? Questions? Leslie, you have a question? Sure.
How are we reaching out to them to inform them that we want them to go?
So yeah, I am happy to do it. Staff can do it, but the bottom line is they should be coming here anyway. This is just part of their that's what they should be doing. And what other committee do you sit on, for example?
The district needs and budget.
Okay, and besides any other? So I sit on public safety and transportation. Public safety and transportation, we hear from the 25th precinct, the 23rd precinct. So we hear from like public safety entities, transportation, so that's DOT, and these folks regularly come. If you're on Parks Environment, you hear from the Department of Parks, et cetera, Department of Sanitation. So these are folks that I believe know that they should be coming at the committee level. It's a matter of enforcing that and making sure that they do. And first, like I said, I would say identify the individual that is supposed to be coming. But this is not anything new. This is what's supposed to be happening. Other questions or comments? Yes.
I did, in response to the agenda, because the Services Committee, I wanted to know if the Manhattan North Division Chief of EMS within the fire department has been notified to bring in information with statistics about ambulance services, mental health services. I know they have units that strictly respond to mental health issues. And because Lenox Hill has removed their units from the 911 system, it has inundated us with services going cross town.
Yeah, so just to respond, so this was also brought up at the Public Safety and Transportation.
Yes, it was.
All right, so then there was a response from that person there. In terms of like in terms of numbers and whether there's a big impact. So I recall that information. So if you want that person to come here and say this and say what he said at the public safety, I have no problem with that.
Well, that's public safety in terms of statistics, response times. This is human services.
Mm-hmm.
What is going on with that aspect in terms of care in this neighborhood?
Mm-hmm.
Because the units were removed from the west side, is this community being negligent of any kind of emergent care because of that? And has it affected this community?
I hear what you're saying. I understand what you're saying, and what I'm saying is that was part of the discussion as well, but we can focus more on the human services part as well, and have that person come as well, so we can do that.
We can also have just the chief, not chief, the captain of the EMS station that's on Metropolitan grounds respond to that. The EMS station that's
I
there.
know, I
And-
look at question.
Yeah, I don't know who, but the captain can come to answer these human services questions. The chief can have that statistics and public safety
So,
response.
yeah, I think so, we talked, so we just identify the person, then we'll need to reach out to the person, that's, I think we can do that. So,
Okay.
yeah.
That's very
So
well.
just, I would say, before the meeting ends, or as soon as the meeting ends, identify that person, have those specific questions in mind, and, give it to the person in advance, and then when he comes, he'll provide that information. Okay. Yep, not a problem. Got questions? Chancellor?
Yeah, just to follow up, Janelle, so you were saying that either you or the staff could do it, but who's going to do it?
Well, first, just give us the name, and I don't care, I'll do it, it's like a matter of reaching out to the person. If
Right.
staff reaches out, all right, reach out, but that's not the issue. Identify the person, and then I'll reach out, or they will reach out.
So then, like, do you want us to figure out, identify, or is that sending an email to the borough president? Like, what's that process of trying to figure out who?
No, so just to be clear, we're talking about just this particular location, and the captain, and so just.
Oh, no, I'm not just talking about,
Okay,
Leslie's, I'm talking about in general.
Oh.
From the email you sent earlier, with all the people that you would love to have speak here
yes.
and to give updates. My question is, who is identifying those people? Like,
Okay.
what's that process like?
Right, so just so you know, Marlene, feel free to jump in. Marlene and I meet, like about a week before this meeting, and we spoke about this then. So we both know that, first, Marlene can identify those folks. That's what she's gonna do. And if I need to, send a personal, invite, which I did, in January, there's some, as the new chair of this committee, I wrote to folks and just say, I'm the new chair of this committee, and we would like for you to attend our meeting. So that's happening right as we speak. So yeah, so we both met and we talked about this, and it's just a matter of identifying that particular person, because, people have, we talked about, name an agency. There was a person that was regularly coming, and we have to, find out that's the same person. If it's not, who's the new person? We all know that almost all of these city agencies have a new person in charge. So, and the person that it might have been coming to at the community level might be the same or may not. But that's happening as we speak. Now, if you're saying that somebody in particular to like that's been that we can speak to, happy to work that way as well.
No, I just wanted clarity on the process.
Okay.
It wasn't clear before.
Okay.
Thank you.
Oh, you're welcome. And just to, I guess, follow through with that. So that was for informational purposes. So these are city agency partners, and I mentioned those, and then I even said, like, having elected or appointed officials here, we may not have, the council person here, but a representative here, from the city level, state level, assembly member, even our Manhattan Borough president, and even district leaders. So, these are folks that, they may not be coming to every meeting, but, we should hear from these folks. And obviously we hear from them at our general membership meeting, but, even at the committee level, that does seem like a big ask. And then I also talked about community stakeholders, community partners, like Carter Burden Network, Borinquen, On Point, for example. These are entities that, they should regularly come here. On Point can come and provide us with kind of updates in terms of their services that they provide, et cetera. Questions or concerns, anyone?
Well, Borinquen Health Center is going through a transition. Their chair just resigned, and now they have a new chair, so she's getting reacclimated. She's Sandra De Leon. She's a new chair, and they just appointed James Ratty and Diana Ayala as new members.
Oh, really?
Yes, so that's, they're going through that initiation phase right now,
Okay,
the
got it.
adjustments.
Excellent. And those, so this is we're all community members, so if you have entities, or if you, again, Chancellor, if you have someone that personally, or the name of someone, let me know. That I would love to invite that person. These are our stakeholders in the community. Anyone else? Appreciate that, listen. All right, so I guess we can move on in terms of our presentation. Is that person? Oh, hello, hello, hi, hello, hello, welcome. The Hope Center, are the folks online, ready to go?
Yes, thank you. I'm just gonna go ahead and share my screen. Can you see my screen?
Yes, yes, we can. Thank
Well,
you.
first and foremost, thank you so much for having us this evening. It is greatly appreciated. My name is Crystal Adamar. I'm a project coordinator here at Mount Sinai, and I'm alongside with my colleague, Amber Stutz, who's a program manager. And today we're going to be talking about some of the resources that the Hope Center provides. So we'll be advancing mental health equity through faith and community-based partnerships. So some of you may be wondering, so what is the Hope Center? Well, the Hope Center stands for Healing on Purpose and Evolving. And we collaborate with Icon School of Medicine, and it became a formal collaboration to provide high quality, culturally informed behavioral health services to residents of New York City. So it is the first joint clinical project that aims to expand access to direct, holistic, culturally sensitive mental health services at the Hope Center, free of charge to low-income New Yorkers. So as well as train psychiatry residents in a multidisciplinary, community-driven framework to promote mental health equity. So the leadership at the Hope Center is Dr. Lena Green. She currently serves as the executive director of the Hope Center, which again is a clinic, a community-based mental health clinic located here in Harlem, and it's connected, and it was established by the FCBC, which is the First Corinthian Baptist Church. So Dr. Green also is a clinical social worker and a psychotherapist by training, a clinical professor at both NYU and Columbia. Dr. Green has received several awards, most recently the Joseph R. Biden Presidential Service and Lifetime Achievement Award in September 2023. Dr. Hankerson is the associate professor and the vice chair of community engagement in the Department of Psychiatry at the Icon School of Medicine at Mount Sinai. He is also the director of the Mental Health Equity Research in the Institute of Health Equity and Research at Mount Sinai. So Dr. Hankerson has presented at numerous settings, including the White House and the United Nations, and the National Academy of Medicine selected Dr. Hankerson as one of the 10 psychiatrists in the US for its Emerging Leaders in Health and Medicine program in 2021. So the history of SCBC counseling to Hope Center. So it introduced the church-based counseling services by providing mental health conversations from the pulpit. It's transparent about battles with anxiety and depression, opens discussions about therapy. Healers need healers. So the in-house services, one clinician on site at the house of worship, available to all members of congregation at no cost, increase in need, concerns about stigma, and client requests for privacy. So as you can see here, there are more people in the US initially seeking mental health care services from clergies rather than psychiatrists. So if you see here on the left side of the screen, this is the list of the professionals. So MH professional stands for mental health professionals. You have the clergy, the general medical doctors, and the psychiatrists. And if you see the percentages here, about 25% to nearly 45% of people are seeking care for mental health professionals and clergy than psychiatrists, which is a little bit over 15%. So why is this important? Well, as we know that mental health is stigmatized, and the Hope Center destigmatizes mental health by not referring to individuals seeking care as patients, but as innovators. So who is an innovator? So one who is making healing a lifestyle. So healing is not a marathon, it is definitely a journey. So what it means to be an innovator is courageously engaging the pain points of your current narrative to transform transform wounds into wellness. And a famous quote from Dr. Martin Luther King, everything that is done in the world is done. Everything that is done in the world is done. I'm sorry, I can't see the bottom part.
Bye-bye.
Yes, thank you. So yeah, the Hope Center impact. So it's free 12 counseling sessions, again, free. Seeking mental health services could be expensive, so we do provide free sessions, and I want to emphasize that. There's group supports, there's wellness initiatives, and innovators do not have to be a member or attend First Corinthian Baptist Church, and they don't have to be a member of any faith-based organization. This is really just a center that is welcoming of anyone of any backgrounds, and referrals are no longer treatment. Referrals are no longer needed to seek treatment, and the demographics is individuals aged between 16 to 76. 90% of our population are Black, 85% is women, 30% are LGBTQ, 22% is seniors, and 18% is teens. So we do offer the psychiatry community elective, and it is hybrid direct to practice. So it provides a total of 8 to 16 hours of clinical services, including medication management and direct individual therapy per week. And sessions could be delivered either in person or remote. And there's educational workshops which facilitate culturally trainings and discussions regarding the interrelationship between psychosocial and physiological problems, psychotropic medication, crisis intervention, and related issues. So there's community programming, which formulates and co-facilitates program with community members in person or virtually to discuss such themes as stigma, negative perceptions, and promote wellness and healthy environments. So again, earlier we talked about a multidisciplinary approach. What does that look like? Psychiatrists working with social workers, working with psychologists and mental health counselors to complement services provided, and the introduction to psychopharmacology to be provided to clinicians on site. So Hope in Harlem. Here we have the Hope in Harlem Competence Combined Faith Sports to promote mental health and mental health services for teens. So from 2000 to 2020, Black and Latino aged 10 to 19 also experienced the largest increase in suicide rates by 78%. So one way that Hope Center approaches mental health is not necessarily only through the traditional lens, but by reaching teens through sports and also focus groups as well. And this is just a quick video. If we have time, just a quick 2-minute video to talk about how we approach mental health within sports.
Month, and this weekend, the Hope in Harlem Conference will encourage mental health care among young people.
You just have to switch your screen over, Chris.
Jesse Mitchell is a reporter covering Harlem and shows us how an innovative program at a church continues to break the stigma for many in the community.
I'm just experiencing a little bit of technical difficulties. One second.
Sure. Take your time.
Oh, can you see my screen now?
Casey Little started playing softball when she was 5 after watching Jackie Robinson videos online.
I'm gonna start it.
September is National Suicide Prevention Awareness Month, and this weekend, the Hope in Harlem Conference will encourage mental health care among young people through sports.
Jesse Mitchell is our reporter covering Harlem and shows us how an innovative program at a church continues to break the stigma for many in the community.
Casey Little started playing softball when she was 5 after watching Jackie Robinson videos online.
After that, I just fell in love with it. I just felt like I could be the first woman in MLB.
Her best friend lost his dream of playing in the NBA this summer when he was killed by another group of teens in the streets of Harlem.
I check on his mom and text her. She told me have a good day on purpose every day. So that's what I try to do.
Now a junior at St. Raymond Academy, Little is determined to look forward to competing in college, complete with mental fortitude, fortified at Thrive, the teen mental health program at First Corinthian Baptist Church's Hope Center Clinic, under the leadership of Dr. Lena Green. We have good street cred, right, with our teens. They're telling their friends, hey, this is a safe space and a safe environment to talk about your feelings. While teaching leadership skills and spreading the word about the 988 National Suicide Hotline, the clinic also conducts community assessments to gauge the growth of participants. We get a sense from the parents our children's grades have increased. We see that they come home more respectful. We see that they're asking for permission or they're willing and open to engage in conversations with us. To expand the helping hand, the clinic's Hope in Harlem conference will bring professional athletes alongside leaders in medicine and education. So I want to be mindful on time. That is some of the services that we provide, which is the Hope in Harlem conference. And that is a conference that is being conducted in Harlem. That's often conducted in Harlem to talk about mental health, to bring together clinicians as well as community members to address a mental health stigma. So, speaking of Hope in Harlem, we had the 2023 Hope in Harlem Conference, where Trisha Hershey, the founder of Nat Ministry, was attending, as well as panelists that include Dr. Signy Hankerson, Dr. Green, Dr. Shilpa Tawfik, and Senior Pastor Michael Walrun of FCBC, who shared a personal story of struggle with depression and the value of therapy. So following the conference, there was a wellness street fair featuring 43 vendors and health service providers at the Mount Sinai Robert F. Smith mobile prostate cancer screening. And importantly, with the generation support of the Mother Cabrini Foundation, the conference also served as a kickoff for firmer partnership between the Hope Center and the Icahn School of Medicine. The collaboration aims to expand to direct holistic, culturally sensitive mental health services and to train psychiatric residents in a community-driven framework. So this is building on the pilot residency training program, which is funded by the American Psychiatric Association Foundation, with support with SOZI Foundation designated with the Hope Center as a site for its community diverse fellowship program. And then Commitment to Thrive, as you can see in the video, Thrive is a group that is hosted at FCBC, which is the church, and they meet on a monthly basis to talk about mental health and topics. So I'm going to pass this on to my colleague, Amber Stacks.
Hi, good evening, everyone. Thank you so much, Crystal. As Crystal mentioned, I'm a program manager working at Mount Sinai in partnership with the Hope Center on this collaboration. So in addition to our free mental health services that we offer, we also have population-based initiatives. We have our groups that are, well, I'll also take a step back. Our staff is composed of social work interns that are second-year master level students, psychiatry residents. We do have mental health counselors. They're also there. One clinical psychologist, and then Dr. Hankerson serves as the Hope Center's medical director. So the social work interns every year will propose their groups based on their innovator population. And here are some that we have. So Embrace is one partnership that we have coming up. The resource fair we have coming up this March will be similar to what a street fair will be. We'll be asking CBOs to come in. They will be upstairs in our fellowship hall in FCBC, and then we'll just rotate people out. And then here is one that we have upcoming. So in July, we'll be kicking off our psychiatry fellowship in research. So it would be sponsored in partnership with the State Office of Mental Health with Mount Sinai. So we're looking for fellows, so PGY, technically fives, that will join us and be with Mount Sinai for 2 years so that they can deepen their research, but then also provide clinical care. I do also want to highlight that at the Hope Center, with our elective that we have with our psychiatry residents, we have PGY 3s and PGY 4s being able to give care as they serve at the Hope Center. With that, we're also able to offer free medication management. Oh, oops. One other thing, for our research and public research fellowship in public psychiatry. We will be hosting an info session on February 24th at 4 o'clock. It'll be virtual, so I can also share that with the committee. And then also want to highlight one thing that we did miss. This year, we recently hosted a public psychiatry forum in partnership with Columbia University to really encourage new trainees to be civic minded, but then also being able to discuss what it looks like to serve in a public capacity. So traditionally, as we know, clinicians or psychiatrists can go into a very structured path where they're delivering clinical care and not so much have a focus on the public and community. So we thought that it would be important to highlight the different paths that can be established across multidisciplines, and what does that look like from beginning your journey as an undergraduate, and then what that can look like post med school.
I know we said a lot, but if you are interested in our services, here's a QR code that you could sign up. And one of our intake coordinators will definitely reach out to you regarding the next steps. If you have any questions, it would be greatly appreciated. Once again, thank you for having us this evening. It's greatly appreciated.
Thank you. Thank you. Any questions from the committee?
Yeah, I'm one.
Council, yes.
Just for clarity, in the beginning, you said this program is for individuals for low income, but then said that it's for everyone. Just clarity. Is it just for low income residents, or is it for?
Yes. So, in the beginning, I did say that it's for low-income New York City residents. Now, when I mentioned everyone, traditionally, there are people from different backgrounds. The biggest misconception is that some people believe that in order to seek services at the Hope Center, given that it is a faith-based organization, that they must be a part of or not an organization, but like a faith background to seek services, specifically with individuals from like the LGBTQ community, non-binary. So when we say that the services are for everyone, it doesn't matter what the background is, but we primarily target low-income New Yorkers.
And
Oh, got it.
Thank you, Crystal. Also, and I will add, there is no. We do ask for income level, but there isn't a cutoff or anything. We pretty much will accept the eligibility criteria is 18 years old and up, a resident of New York State, and we recently had to limit our intake to anyone who has not received services in the past 3 years or direct services in the past 3 years.
Yes.
Hi, I'm currently dealing with young adult foster care youth who are aging out of foster care. Would you guys be able, like, I think their ages like 18 to 21, they're like still under the city's, umbrella of the state. So will your organization be able to help them?
Absolutely. Yep. Anyone 18 and up, no matter their circumstance. We also have a youth initiative for anyone under 18 called Thrive. It's a youth suicide prevention program that we hold monthly. And now we have it scheduled for every third Wednesday of the month. So that can also be a resource for anybody under 18.
Oh, perfect. Thank you.
I have a question.
Yes.
You mentioned that you have 5 sessions per group. Is that sufficient? And what do you do if it's not?
Excuse me.
We have 12 sessions per. Oh.
12 was Hope, and you guys were 5.
Oh, I think was that with Embrace?
Yes, Embrace.
So that's one of our partnering organizations. I can follow up with them. We do invite organizations to come in and partner with us because we have the connections and the long wait list. But I can follow up with them. I know for our 12 sessions, we can have flexibility if people are in acute crisis. We will continue to see them if they're not able to secure ongoing therapy. If they are in in that need and in crisis at that time, we won't just let anyone go. We do try to also connect them to Mount Sinai OPD as well, if they're able to, knowing that there is still a long wait list throughout the city.
Where exactly is the Hope Center located? Your exact address?
Yes, so we're 228 West 116th Street, right between 7th and 8th Avenue, and FCBC is on 116th Street, or on Adam Clayton Powell on 116th, right on the corner.
And in terms of the innovators, what's your capacity?
So currently we have 4 interns that are assisting, and they usually carry about a six-person caseload. The institutions have reduced clinical practicum hours across the board throughout, like, Columbia, Hunter, and all of these other prominent social work programs. So it has been reduced from, I guess, what we started till now. But that's about it. We have about a wait list between 3 to 5 months.
Any other questions?
Can you repeat another place they can refer people seeking help, like if they have a 3-month wait time?
So, with the wait time, given that it is a free psychiatric mental health service, there is such a high demand, but we don't just leave people in the just waiting. We reach out to them by providing them resources and connecting with them, because some people need immediate care than others. So we always ensure that we reach out to them to connect them to services.
And I will also say Crystal does a great job following up and connecting people to resources as well. We established, we have these automated messages that will send out a resource list where people can sign up for additional services. But as people wait on the wait list, Crystal does walk through and does some outreach to assist with case management as well.
Are you guys connected to the Mount Sinai Adolescent Clinic? Are you connected to that at all?
Not officially, no. But we do refer our innovators out, or if there were younger folks that came through Thrive, or if a parent had a youth with them, we would refer them to the Adolescent Center.
Okay, can you repeat the address again? I'm sorry.
Yes, no problem. It's 228 West 116th Street. And it has a big H on the door.
Any other questions? Anybody? Any hands up? Any questions? Well, thank you very much for the presentation. So this was for our edification. This is just kind of, you're just talking about the services. You're not really requesting anything particular. Is that correct?
Yes, just wanted to share the information. We would also appreciate being able to share a flyer about the fellowship that's coming up.
Okay, sure. Did you provide that already?
But thank you.
Did you provide it to the board office, that particular flyer?
We will. We'll send it. We'll send an updated one. Thank you. I'm actually, Crystal might have. Go ahead, Crystal. I'm sorry.
I did send it when I submitted the presentation request, but I could resend it this evening.
Great, thank you so much. Thank you all, we appreciate it. And feel free to come back and kind of give us updates on occasion, we would appreciate that.
Thank you so much for your time.
Thank you.
Thank you.
Thank you. Alrighty. Okay, and if you have any follow-up questions, feel free to send to me or to Maureen, and we can probably send it out to the folks there. Moving on in the agenda, everyone. Old business, any old business, anyone? Yes.
Well, we talked about before, but I think that discussion on a moratorium expired should at least be had. You asked for statistics, and FOILs in 2020 show 37 districts out of 50 in this city do not have one treatment facility. And we're treating like we have 1.8% of cases, and we're treating 18 now in the city. Our own congressperson, who I think first was kind of for these things, is now out in 2024 saying he's not for them. I think that there's a way to do this that maybe wasn't done before, which maybe we're only identifying problems as opposed to identifying them and offering our own solutions. But there's a lot of funding that goes into these programs. And why can't that funding be diverted to helping these people in a dignified way that actually gets them the help they need? Oasis made the claim that they shouldn't be reducing, or we're not citing them because the rate hasn't gone down in 30 years. Well, that could also be looked at as, well, then you haven't really been helping the case, have you? Because it's the rate. So populations go up, whatever, but that's the percentage of the population. So I just think these are points that need to be made. It expired, as far as I'm aware, not because the board changed its opinion on it, but because it expired. It also doesn't have to expire. It's a living document. What you agree on today or the board agrees on today can be changed tomorrow. And I'm not telling you what position to take or to put it back in, but I have not heard the sentiment change. I haven't heard that the statistics have changed. And I guess the last point I'll make with a facility like On Point, and this is just a general observation, I could be completely wrong, but I believe no one overdoses in there, which is great. The question is, are people more inclined to overdose in there because they know that they'll be able to, not die from it? I mean, these are just things that I don't think they've looked into. They don't know. They cite things in here. And then, Jewel, I know you asked for statistics, and it's kind of concerning that we can't have statistics every year. And we're relying on 3, 4, 5, 6-year-old studies as opposed to a new study every year. And it's the same thing I told HPD with supportive housing. It's there are loud voices in this community. The louder voices are the ones against it. So we don't know. That doesn't mean it's everybody. The loudest voice in the room doesn't mean it's the most voices. But when you deny statistics, when people have a certain opinion, and they start to wonder why. So I agree that we need numbers, but when you start to demand them and that they say that they don't have them, that'd be interesting, right? Because I guess my question when you ask for them is, if they say they don't have them, then how do they know we need more of it? So these are the questions to ask. You must have numbers if you're citing new ones and this and that. And, when you say overdoses have gone up in the neighborhood, is it overdoses from people from other communities who are just overdosing when they come in here, or vice versa? Because the argument too is when you saturate everything in one place, then where do all the dealers go? Right? It's almost like it's almost like, imagine building a supportive housing and saying it's for domestic violence victims, and you advertise that. Would you ever do that? No. So why would you do it with this? So, I mean, these are just questions. I'm all personally for them putting more funding here to help people the right way, but not with the way I think they've been doing it all here. I think it's messed up on many levels towards our community, but I just think it's a conversation that needs to be had, until something's figured out. Until we decide, oh, you know what, we don't need it or not, but not having it sends the signal that if I was someone trying to cite one here, like, well, you had it for 5 years, you don't now. I guess it's okay now, right? I mean, if I wanted to do it, I would use that argument. So I guess, and the last thing is, other boards say no at conditions. They say no unless you do this, and then it's a yes. We say yes unless, if you please do these things, but we don't really ever find out, right? Wouldn't it be better for us to know they did everything or they committed to it, and then we don't always have to be hunting them out, which we should be doing anyway. But it does seem like a backwards way of thinking. And it seems like we think we have to give up all our leverage right up front. And not just in this, I'm just talking about whether it's parks, we have to maybe relook at how we negotiate with people. That's it, so.
And that's the start of this conversation. So, I sent you all the email, hope you all saw it. I specifically, pointed out the, first of all, I titled it, Mental Health and Substance Abuse Treatment and Prevention Programs in East Harlem, and then in terms of New York State Office of Addiction Services and Supports, or OASIS, and then the fact that there is a moratorium that has lapsed that this community board had in place. And I put a little blurb about the moratorium. I'll just read it for all purposes of the record. Moratorium on this, and this is just some, just some blurb. The moratorium is on the sitting of any new drug rehabilitation, chemical dependency, or treatment centers to be located within the confines of CD11, and requiring all existing OASIS authorized drug rehabilitation, chemical dependency, and treatment centers to come before CB11 prior to all authorizations and or expansion of services or service capacity. Any comments from folks?
Yeah, I have some comments. When this was first said, who did we send it to, and did they even recognize? Right? Did we just send it to them and never got any reply back?
Marlene, you commented earlier about some of the effectiveness of this. I don't know if you mind sharing. You've been sitting here longer than all of us.
Yep, when it was created and drafted, it got sent directly to OASIS. And so, because you guys are advisory, you were advising and requesting a moratorium. You were asking OASIS to stop any new sightings of substance misuse facilities in the district, because the argument was that there was a saturation in this district. And so the result of that is that OASIS now asks any facility existing or new to come before the body and tell them that we are requesting, for example, 50 additional beds in an existing facility, or we're coming to open a facility on such and such street and corner. Now, that doesn't mean that OASIS will deny their request for additional anything or new. It's saying go to the board that is saying that the district is saturated. You need to speak to the body and have a letter of acknowledgement or support attached to your package. That's what came out of your request for a moratorium.
Hello?
Can I make two more comments?
Sure.
And then, it's a good question, and I didn't say you asked this, but just the effectiveness, we can't always look at that because we are advisory in every capacity, right? So technically, if we based everything on, well, did they listen, we could make the argument that we shouldn't do anything, right? Now, sometimes when we're getting no's all the time, we can rethink how we do it. And Jen, and I'm not trying to steal your idea, but I thought it was a good one, and correct me if I'm misrepresenting it. I think one of the things that the committee was looking into, if it was going to be put back in, was to identify what this isn't talking about, right? So not to say, somebody could read this and think we're talking about any kind of social services in this community. And so I think it might be important to identify what those services that we're not speaking about are, so that just as much as we're like, this is what it is, this is what it isn't. And so I think that's it from me, but thank you.
And then the points that I made in my was like, first of all, like data, I'm very repetitive about this. When you look at data, right? So it's one thing to say, and I'm not saying yes or no, I'm just saying, what is the data? Does this data show that CB11 or the East Harlem is oversaturated, overburdened in terms of these facilities? And we can look at, as opposed to, Midtown or other areas of Manhattan. So what does the data show? And then, or, is 116th Street overpopulated, oversaturated with facilities? So that's one thing, and we kind of like talked about that. And then what are the current locations of these facilities specifically? Third point was like compliance. Are they complying? So Marlene just said that they are aware that they need to like come before us in terms of things that happen. 4, how is this being enforced? So that's kind of goes with compliance, but how is it being enforced? And then also like, one of the last things, the relevance. Is this still relevant? It's still needed to be discussed. So those are the kind of the points that we want to kind of like talk about. Any comments? Anyway.
Okay, so since this is in OASIS package, do we need to redo this moratorium since it's already in there? Just asking, just wondering.
Do they still come like they did when it was in place?
Yeah, but we haven't, this committee hasn't had anyone requesting. Yeah, for maybe like, I would say 6 months to a year. There was a lot of letters of support coming out of this committee like a year and a half ago.
I mean, I guess the question you have to ask yourselves is, you live here and work here and whatever, how do you feel on top of all of that?
I have a question, sorry, I don't know much about this, I haven't been involved before. So before you provide this letter, can you ask for the statistics for them to provide it for you?
Well, I will do, that, to me, that's the,
Some of the statistics already, and there was
Oh, yeah,
included
right.
in the initial moratorium as well.
yeah.
So it's not like being submitted with like no statistics or anything.
So just to be, so the document, I just took out some of the things, so the actual document itself, we can just go to that, how many pages is the document? Or we just like send that out?
5 pages.
5 pages. So why don't we just send that out, the current document, and then you'll take a look at that, I just talk about numbers, I mean, this document was what, signed when, it was dated when, and those are the numbers, I'm not saying numbers have changed substantially, I'm just saying. So that's the document, it's like 5 pages, I just took, like I said, a little blurb out of it, but that's what it is, we'll send that out. And to your question about whether it needs to be revised or updated, take a look at it, everybody. Let's hope there's not a lot in terms of like, cause I think people have worked, I was on the committee like years ago when they were talking about this, so. And it's like back and forth, and then of course there's like, 50,000 opinions about things, but let's just come up with like the main points of it, and I think that's what exists now. And then from there, we can talk about like as we move forward. How does that sound? And other questions?
No, I mean, I would like to see it too.
Yeah. So let's say, again, I just took out a bit of it, but let's just send that out. Marley, can we send that out to folks? Okay. Any other questions? Yes.
Has it already expired or is it about to?
Oh, it's expired.
Unless if it's, I think the only expiration part though was the sitting of new facilities, and the part about asking them to continue coming was not tied to months, was it?
Okay, so then that's something we.
I think you might be right, that's what I've heard.
Yeah.
But I feel like that's the most,
Right.
that's the most contentious part of it all.
Yeah, okay. All right, so yeah, that's a good point.
I'm sorry, forgive my ignorance
No,
here.
no, not at all. This is,
Well, what's the disadvantage of, like, what's the counterpoint of not basically reinstating it? Why do people not want to, or not want to do it?
so that's some of what Adem was kind of saying.
I don't think there's anyone that was against.
Just.
I don't think there's anyone that was against.
Yeah.
I just think it didn't happen.
Yeah.
And then, so it's, this exists, right? And it existed. And then, the appearance is, if we don't review it or we look at it as a living document, then people, then I'll put it this way, then we should not hear from the community about, we have issues of oversaturation. I don't know how that sounded, that came out kind of badly.
No, it's okay.
Okay.
The other reason is I believe the committee was under the impression that this had to be renewed every year. And I'm not talking about the committee leadership at the time, it's what I believe they were told. And that's just not true. It can be as long as you guys want. It doesn't have to expire to be revised. This could be looked at as a living document. You could end it when you want, you could not end it. There's no 1 year this, 1 year that. I don't know why the board was under that impression, but I can confirm that that is not accurate. And that is not something that the prior leadership has said, whatever, that's the impression they were under. And I agree with Jen that I don't think anybody didn't want it. I think it was looking into how to maybe change some of the wording or this or that. And then my counter to that, and again, not to that leadership, was had this not had that expiration date, could have theoretically been revised without it ever having to not be in effect. There was no discussion because of the way things played out as to do people not want this anymore. So it expired without that discussion happening, right? So I guess, and I don't think that this has become any less important of a conversation than it was when it was put in. Now, opinions might change, statistics might change, but I don't feel like the sentiment that this is not an important conversation, one way or the other, is not true.
Yeah, I think like the initial initiative was to like put in more about like, for example, say like what this isn't. And I feel like a lot of times when housing came up, people would be like, well, if we're housing people that have a chemical dependency, like this goes against the moratorium. It's like that, everyone needs a house. And you say you don't want them on the street, but then you also don't want them in a house, like where exactly?
So, and if there's some wording where there's some wording about some kind of date or expiration, then that's gonna be the problem. So this whole thing should say in perpetuity. That will
I
solve
think it's
everything.
just that one line that says it, which
Right.
matters a lot.
So just add in perpetuity for
But
the
thank
whole
you for
thing.
catching that.
So that issue with the issue with the supportive housing, that, I can't think of its name right now. I know there's some issues with it, that people were having issues. They didn't want it here. And I think, former, councilwoman, I know she didn't want it here either. I can't think of her name. You and I.
Yeah, it's St. Francis.
St. Francis, right? So
Yes.
in particular, did St. Francis not technically fall under the moratorium?
No.
Come here?
No.
Because they're not considered a treatment center?
They're coming, by the way, for anyone who's interested, to executive, at the end of this month, and the reason is because it's gone to housing, it should have come here, so we're trying to have everybody, since it's touching on so many committees, to have them come there. I'll share with you the 33 questions that I prepared for them, in advance, but, oh, you have them, okay. We're actually interested in knowing what services they have there. I'd be happier to know that they have services for them, the people that live there. I think the other narrative that we have to get away from, and I agree, some of the people who've shown up here from the public, while they have to be heard and stuff, they use very poor words. It's not said correctly. I understand they might be upset. That's no excuse. But we've also, from what I've seen, I've been in this board a long time, is we're told, oh, you don't want help? You don't want to help anybody? You're saying no? And it's like, no, that's not what anyone here, I've ever heard anyone on this board say. It's, we're going to keep helping. Can they also help? So, let me just use a quick example. Me and you are neighbors. 20 homeless people show up to be fed and this and that, and you feed all 20. The 21st comes and you turn to me and say, okay, your turn. And I go, why, you don't want to help them? That's essentially how East Harlem's been treated. So we're made to look like we're saying we don't want to help. We're just like, no, why don't you help too? Right? I think that's the way I've seen it play out over the years.
I think also, like, people are going to succeed better in treatment if they're receiving it in their neighborhood than if they're traveling like
there you go.
forever away to get it.
Other questions, concerns? Yes, yeah, I actually printed out the questions we had for safer. Well, I added my own. One of the things I said was that, yeah, they should come before this committee as well as in terms of they're providing services. So, yeah, I mean, it's a house, it may be housing, but there's also, you're providing, supportive housing. And then we'll talk about what does supportive housing mean, et cetera, et cetera. All right. Any other, and yeah, I would advise you also to make your way to the executive committee meeting.
You can join on Zoom, remember, you're not a committee member, you just go on.
Open meetings, well, let go in. So yeah, in terms of, what are the lasting questions about the moratorium? Okay, because, so that's under old business, so I think the next step, and this is for everyone, as an action, get a copy of it, that will be sent out, and read it, and have some questions. How's that? Everyone. Okay, any other old business? Anyone? Okay. New business?
Yeah. A couple weeks ago, I attended the Assemblyman Eddie Gibbs, basically New Year's speak, where he talked to the constituents about what he did and for 2025. But something that stood out to me, he was talking about the Centennials. So East Harlem has about 7 or 8 residents who are at least 100 years old. And there's a super centennial here in East Harlem who's 110. And he is doing, like, I think, a breakfast for them. Sometime this month or in March. I was wondering if we can get more information about that, or if any of that information was sent to the board.
I haven't got anything yet, but that sounds cool.
Because, yeah, that to me is human service as well. We talk about our seniors, especially, we always talk about helping our seniors, but sometimes we have to highlight them as well. So hoping anyone knew any information about it, or ways that we could potentially recognize them.
Yeah, it's interesting because, decades ago, the board had like an annual senior forum, and I mean decades ago. So yeah, and obviously this is all part of human services. It's like human services, healthcare, and aging, seniors, et cetera, et cetera. So yeah, let's reach out again. That's why we would like these elected officials or their reps to let us know about events taking place or even the events that are being planned. We can reach out, or you can reach out. Feel free to reach out to the assembly person, and you can get more information about that. What else? Okay. I want to just make mention of let me go back for just a moment. In terms of the nurses strike. We did invite Brad Beckstrom to come back again. If you've seen the latest news, there's been an agreement reached or some sort of an agreement. And we will have more information, but just so you all know, Brad actually sends an email practically every day to me, to my attention, and to Adem's attention in terms of the nurses strike. And he's been doing that. So, and today's announcement, he did indicate that good news in terms of they've agreed to terms with the New York State Nursing Association rather. There's a tentative agreement in place on 3 campuses. And we expect the process will run through Wednesday, February 11th in terms of, the agreement. But that's good news. And again, we did ask him, and he's been very, 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 very open about, providing information. So just so you know, that's excellent, good news. That was good news. That's all business.
I also been in contact with the nurses union. I think with everything happening just this weekend, they didn't feel like they had much to speak on or like concrete things to speak on today. But I invited them also to come to next meeting to kind of talk about what happened and then like moving forward, how we can support the nurses in the community.
Okay. So when you do something like that, make sure that I'm aware of that. So you're saying you invited who and what, and give me the specifics, okay?
Okay, yes, we also discussed it last.
Okay. Yeah, like the who. So and is it you're talking about from the actual association itself?
Yes.
Okay. Great.
If you get any more updates, could you forward that to us as well? I know you said y'all were getting the updates every day.
Yeah.
Essentially.
I'll ask him because
Yeah.
sometimes he says something and he's like, I don't know if I can,
Yeah.
but I'll find out.
Yeah,
Whatever, I'll tell him, I'll say when you send it, let me know if this can be shared.
Yeah, yes. We'll just, we have to check with him first. Because he really is very, very open about providing information in terms of the strike. Any other old business? I do want to make sure you are all aware that the East Harlem, community, let's see, well, the COAD and the other East Harlem Association here, Community Health Committee, they're having their meeting tomorrow, which I will be attending. It's on Zoom. And the COAD is meeting right after they meet. So the meeting is tomorrow, Tuesday the 10th, from 10:30 to 11. That's the Behavioral Health Subcommittee. And then after that, the COAD is meeting. And just so you know, everyone, that's a special meeting that the COAD will be doing. And I'm just going to read what they're saying. In the wake of increased concerns around immigration and U.S. immigration and customs enforcement, we wanted to set up a meeting to talk about what different East Harlem organizations are doing and planning about an individual's rights and what to do once someone is detained. So it's a conversation, and they're saying we don't want to work in silos. We want to share best practices, ideas, and concern. concerns. We're not experts, but we want the community to be involved. Again, I will be attending that. That's tomorrow. It's a virtual meeting from 10:30 to 11, and it's the East Harlem COAD. That COAD stands for Community Organizations Active in Disasters. So they are highlighting in terms of providing information as it relates to U.S. immigration, customs enforcement, and what folks can do in the community. I can provide the link, and if you would like to attend that, very important meeting.
Can you share?
Yes, I will share that.
Share that with me as well, please.
Share. Yes, I'll send it out to everybody. I also want to say the East Harlem Community Partnership has their monthly meeting that's taking place next week on the 18th. This is the East Harlem Community Partnership, and I'll be attending that. This is also Zoom or in person. It might be in person. So just to let you know. Any other old business?
It says scan to RSVP.
Yeah, sure. Oh, that's something. That's just like the regular community partnership. Any other old business, new business? Okay, new business. What's left? So just a roll call.
If you're ready, I'll call the roll.
Okay. Yes. We can do roll call.
Leslie Colon,
Present.
Ada Parisi,
Present.
Chancellor Gregg,
Present.
Jill Jones,
Here.
Jennifer Meyer,
Present.
Tanya Phelps,
Present.
Valerie Conti. Valerie Conti.
Oh, yeah, she can. She's right there. We need a, do you need verbal?
I need verbal. Valerie
Okay.
Conti, just say present, please.
Or put in the chat.
Present. I don't know, what did it say?
Janelle Satija,
Present.
Robin Stration is absent.
Yes.
I forgot to recognize ex officio for this meeting, Adem Briha. Thank you.
All right, thank you, everyone.
Thank you. Can I get a picture of the tax?
Yes. And let's see. So let me see. How's that? So that's and that's Bellevue. And now I don't have like the flyer from Metropolitan. I just have that. But they